This is the second part of the video on vitamin B12. If you have not seen the first part, I encourage you to watch it. The link to the first part can be found in the description and in the comments. Now briefly, I will present who may be particularly at risk of too low a level of vitamin B12. It mainly concerns patients suffering from absorption disorders and disturbances in food components. This group includes individuals with Crohn's disease, small intestinal bacterial overgrowth, SIBO, celiac disease, or infection with the bacterium Helicobacter pylori, which is associated with inflammation of the gastric mucosa. Vitamin B12 deficiency also occurs in individuals who have undergone gastric resection or small intestine resection. A deficit of this vitamin is also observed in cases of Addison-Birmer anemia, an autoimmune disease that leads to the damage of gastric parietal cells that produce the intrinsic factor known as Castle's factor. This factor binds in the digestive tract with vitamin B12, enabling its absorption. Therefore, even if vitamin B12 is supplied with food, its absorption is hindered in the absence of Castle's factor. Vitamin B12 deficiency is also frequently observed in older individuals. This is due to several reasons, including the syndrome of poor absorption of vitamin B12, atrophic gastritis, and reduced levels of hydrochloric acid, which makes it difficult to release vitamin B12 from food. It is also important to note that a deficiency in vitamin B12 can result from taking certain medications. These include proton pump inhibitors such as omeprazole, H2 receptor antagonists like ranitidine or famotidine, used for treating stomach and duodenal ulcers, as well as gastroesophageal reflux disease. Metformin, one of the most commonly used drugs for diabetes, can also contribute to a vitamin B12 deficiency. Literature data indicate that even 1 in 3 patients taking metformin over a long period may develop a B12 deficiency. The fact that metformin can disrupt the binding of vitamin B12 with Castle's factor is due to certain biochemical changes that occur during its intake. These changes can significantly hinder the absorption of vitamin B12, which is often overlooked in medical practice. This happens because, as I mentioned earlier, a vitamin B12 deficiency does not always involve hematological symptoms, those associated with anemia. Often the dominant symptoms are neurological due to neuropathy or nerve damage. This is significant because similar symptoms can result from diabetes itself, known as diabetic neuropathy. As a result, a patient suffering from diabetes who is taking metformin and reports symptoms such as tingling, numbness of the limbs, burning, scalding, or pain in the feet may be misdiagnosed. These symptoms may be mistakenly attributed to poorly controlled diabetes, when in reality they may stem from taking metformin. Therefore, I recommend that individuals who have been taking this medication for an extended period should have a blood test to check their vitamin B12 levels. Among those particularly at risk of vitamin B12 deficiency, vegans should also be mentioned. Since vitamin B12 is mainly found in animal products, individuals following a vegan diet may be at risk of its deficiency if they do not use appropriate supplements or consume products fortified with it. It is correctly observed that almost the only dietary source of vitamin B12 is animal products such as red meat, offal, fish, seafood, eggs, and dairy products. This is precisely why it is difficult for vegans to obtain an adequate amount of vitamin B12 solely through a plant-based diet. There is a belief among some people transitioning to a vegan diet that obtaining vitamin B12 from food is not necessary because gut bacteria produce this vitamin. Indeed, some beneficial microorganisms produce vitamin B12, but the key fact is that this vitamin's production occurs in the large intestine. The problem is that the absorption of vitamin B12 takes place in the small intestine, which is earlier in the digestive tract. There is no possibility for vitamin B12 produced in the large intestine to move back into the small intestine where it could be absorbed. Other causes of lowered levels of vitamin B12 include alcohol abuse, prolonged use of oral contraceptives, chronic pancreatitis, or parasitic infections. If you experience any of the previously described symptoms, or if you belong to the risk group for vitamin B12 deficiency, it is recommended to undergo a blood test to measure the concentration of this vitamin. The issue of norms for vitamin B12 is controversial. It is accepted that the normal concentration of vitamin B12 ranges from 200 to 1300 picograms per milliliter or nanograms per liter. As mentioned, there is a possibility that a hidden deficiency of vitamin B12 can develop even when the blood test result is within the normal range, i.e., in cases of concentrations around 300 and even 400 units. Based on available literature data, it is considered that the desired concentration of vitamin B12 should be at least 400 units and optimally aim for a level of 800-900 units. It should be emphasized that the concentration of vitamin B12 in the blood does not always accurately reflect its actual saturation in the body. Therefore, if the test result oscillates around 300 to 400 picograms per milliliter or below, it is worth considering additional tests. One of them is the determination of the homocysteine level in the blood, which, as mentioned earlier, increases in the case of a vitamin B12 deficiency. However, it is important to remember that an elevated homocysteine level is not always a direct indicator of a lack of vitamin B12. Increasingly, it is also recommended to measure the concentration of holotranscobalamin, the active form of vitamin B12. This test allows for the detection of a vitamin B12 deficiency at an earlier stage. Another sensitive indicator of vitamin B12 deficiency in tissues is the level of methylmalonic acid MMA, which can also be measured. Indeed, measuring the level of methylmalonic acid, which is one of the more sensitive indicators of a vitamin B12 deficiency in tissues, is important. Additionally, a complete blood count, CBC, can also be helpful. In the case of anemia resulting from a vitamin B12 deficiency, a characteristic increase in the volume of red blood cells is observed, which is denoted as MCV, mean corpuscular volume. There may also be a decrease in the level of white blood cells, platelet count, neutrophils, and hemoglobin. However, as has already been mentioned, a vitamin B12 deficiency does not always lead to anemia, so a blood count should be considered as a supplementary examination. When it comes to providing and supplementing vitamin B12 deficiencies, it is crucial to ensure a properly balanced diet. Products that are rich in vitamin B12 include, among others, offal, such as beef or chicken liver, poultry and beef, herring, rainbow trout, salmon, eggs, and dairy products, including natural yogurt, kefir, yellow cheeses, and cottage cheese. It is important to emphasize that plant products generally do not contain significant amounts of vitamin B12, as they are not capable of synthesizing it. Indeed, although it is possible that plants may have bacteria that produce vitamin B12, the amounts of this vitamin would be rather traceable. Moreover, vitamin B12 is unstable, which further limits its availability in plant products. Chlorella, a green-blue alga, may provide some amount of vitamin B12, but it is important to remember that another microalga, spirulina, contains mainly what is known as pseudo-vitamin B12. This is a form of vitamin B12 that is inactive in the human body and does not produce a physiological effect. Regarding the recommended daily intake of vitamin B12, scientific societies have established its recommended amount at 2.4 micrograms per day. However, an increasing number of experts suggest that this level might be too low and recommend increasing the daily intake of vitamin B12 to about 6 to 10 micrograms. This indicates that some aspects concerning vitamin B12 might be underestimated, and a change in approach to this vitamin could be beneficial. Indeed, the recommended daily intakes of nutrients, including vitamin B12, are primarily established with healthy individuals in mind. In situations where the body is dealing with various diseases, the need for nutrients can increase. For individuals with a low level of vitamin B12, that is below 350 picograms per milliliter, the use of supplements containing vitamin B12 is recommended. Suggested doses range from 500 to 1,000 micrograms per day until the optimal blood concentration is achieved. It is also advised to divide the daily dose into smaller portions, which promotes better absorption of the vitamin. For individuals who only want to slightly increase their vitamin B12 levels, the use of approximately 100 to 200 micrograms per day may be sufficient. It is important to note that there is no risk of vitamin B12 overdose, which makes it relatively safe for supplementation. Regarding the chemical form of vitamin B12, there are different opinions about which one is the best. Despite the differences between forms, such as methylcobalamin or cyanocobalamin, and various methods of administration, oral capsule or sublingual tablet, these variations are not significant in terms of effectiveness. In cases where oral administration of vitamin B12 does not yield the desired results, an alternative method is the use of intramuscular injections of vitamin B12. This method of administration can be particularly effective for individuals with absorption issues related to vitamin B12. If you enjoyed this video, please don't forget to subscribe to my channel. Thank you for your support and see you soon.